While South Dakota is opening up 10 new temporary testing sites, people in other communities are still being told they're not eligible to get a test. We're looking into whether or not the state has been keeping its promises to the federal government when it comes to testing for COVID-19. In tonight's KELOLAND News investigation, KELOLAND's Angela Kennedy has been digging into the documents and reports and compares South Dakota and North Dakota testing rates and finds out why more testing matters in the battle against the spread of COVID-19.
A lot of federal money has been handed out to South Dakota for COVID-19 testing. South Dakota's Department of Health got nearly $70 million in federal funds to expand testing. Now, that money included flu season preparedness and getting ready for a potential COVID-19 vaccine. South Dakota also had to submit its COVID-19 testing projections to the feds in order to receive the money. According to South Dakota's testing plan submitted to the U.S. Department of Health and Human Services for May and June, South Dakota would test 35,280 individuals in May and 44,100 people in June. It looks like that did not happen. According to our KELOLAND News records, in May, South Dakota tested 27,100 individuals, and in June, it tested 36,010 individuals. On July 10th, the South Dakota Department of Health submitted its testing plans for July through the end of the year. The state pledged to test 55,000 individuals for active COVID-19 infections each month. The South Dakota Department of Health lists 44,233 tests as its goal. That's nearly 10,000 fewer than projected. But the state says its number is total tests, not individuals tested.
We are testing, and we tested well over our goal of 44,000. We were testing over 100,000 tests and nearly 150,000 tests just last month for the month of October. And so, while some of those individuals are tested multiple times, a lot of those individuals are tested for their first time as well.
According to the U.S. Department of Health and Human Services report to Congress on COVID-19 strategic testing plan in May, modifications to state plans may be necessary if patterns of virus transmission change or are projected to change, increased case rates are observed.
The state has not amended the current plan, but again, as the numbers show, you are well exceeding the goals that were set out initially.
And so the value in really testing as many people as possible is quickly identify where the disease is occurring, isolate those people, quarantine their contacts, and that essentially really does help you preserve your hospital capacity and pretty much reduce the extensive spread that we're seeing currently.
Grace Zhao is a state epidemiologist for North Dakota. North Dakota received nearly $5 million less in federal funding for testing, but increased its testing goals from 105,000 individuals in June to 248,000 in December.
It does have to be part of your strategy. I think you really do choose how you invest your dollars, and I was quite impressed by how the state health department and the governor's office really in North Dakota heavily invested in making sure that if you want to get a test, you should be able to get a test.
According to Johns Hopkins COVID-19 tracer, North Dakota is performing 11 tests per 1,000 people with a 16% positivity rate. South Dakota is performing 2.5 tests per 1,000 people with a more than 54% positivity rate.
But when you see a positivity rate that's that high, it tells me there is actually quite a lot more cases that are undetected in that population.
Zhao says while testing numbers and positivity rates can be figured out in different ways, the numbers don't lie when it comes to hospitalizations and fatalities. North Dakota's hospitalizations have been at about half of what South Dakota's have been, but deaths in North Dakota have been slightly higher due to a high number of cases in long-term care facilities.
Thanks, Angela.